Hey guys, today we are going to talk about prostate gland enlargement, in other words BPH. BPH means Benign Prostatic Hyperplasia. Researchers have found that in men over 60, 70% of men have BPH. Over the age of 70, 80% of men have this disease. You may want to know what exactly happens. In this case, the cells in the prostate themselves start multiplying and start forming nodules within the prostate. The prostate is a walnut-sized gland that is located below the bladder and right in front of the rectum. As the prostate grows, it blocks the urine from coming out of the bladder. Now, this may cause symptoms of bladder obstruction. Bladder obstruction symptoms can be categorized into voiding symptoms and storage symptoms. Let us start by discussing the voiding symptoms. Common voiding symptoms include urination hesitancy, that is the trouble starting urination; weak urine stream, that is the diminished force of urine flow; intermittency, that is the stream starts and stops; straining, that is the need to push or bear down to urinate; dribbling, that is leakage of urine after urination; incomplete emptying, that is a feeling that the bladder isn't fully empty after urinating. Storage symptoms, on the other hand, refers to the problems with the bladder itself. This one includes things like urination frequency, that is the need to urinate more often than usual. Another one is urgency, which is a sudden strong feeling to urinate. Another one is nocturia, which involves waking up several times at night to urinate. It is important for you to note that having BPH does not mean that you are going to have symptoms. Some men usually have symptoms while others do not have symptoms that normally appear gradually as years progress. You may notice this as early as over 40s as it continues to progress over time. Another point for you to note is that we cannot be 100% sure if urinary symptoms are caused by BPH. While BPH is the most common cause of urinary symptoms, there are other causes of urinary symptoms besides BPH. Now let us begin by discussing causes of urinary symptoms besides BPH. The first cause is infections and inflammations. Infections are the most common causes of urinary symptoms, particularly in women. Examples of infections include urinary tract infections, or UTIs. Bacteria present in any part of the urinary tract, that is the urethra, the kidney, the bladder, can cause frequent and painful urination, urgency, and sometimes blood in urine. Next on the list is prostatitis. Prostatitis refers to the inflammation or infection of the prostate gland, not necessarily enlargement. This can cause pain in the pelvic area and urinary symptoms, particularly in men. Sexually transmitted infections such as chlamydia, gonorrhea, and herpes can cause urethritis, that is the inflammation of the urethra, and lead to painful urination and discharge. Next on the list is interstitial cystitis, that is painful bladder syndrome. This chronic condition involves inflammation of the bladder walls, causing frequent urination, urgency, and chronic pelvic pain, often without an infection present. Urinary symptoms can also be caused by neurological conditions. Now, the following neurological conditions can cause urinary symptoms. So the first one is stroke. Stroke can interfere with the brain's ability to control bladder function. Now, another cause of urinary symptoms is multiple sclerosis, also known as MS. Multiple sclerosis affects nerve signals, often leading to overactive bladder. We can also call it inability to empty the bladder completely. Another cause is Parkinson's disease. Parkinson's disease is a disorder of the central nervous system. Parkinson's disease may cause neurogenic bladder symptoms. Another neurological cause of urinary symptoms is diabetes. High blood glucose level can damage nerves. Nerve damage or neuropathy may actually affect bladder function and also damage. Neuropathy over time may affect bladder function and sensation. Another cause is spinal cord injury. Trauma to the spine can disrupt nerve communication. This may lead to loss of bladder control or urinary retention. Urinary symptoms may also be caused by structural and obstructive causes other than BPH. Physical obstruction other than BPH can block urine flow, and in the process this may cause symptoms. Now, one of the physical or structural causes is urethral stricture. Urethral stricture, in this case we are talking about damage to the urethra, which may lead to formation of a scar. Now, this tissue may narrow the urethra, making it difficult to pass urine. Urinary symptoms may also be caused by bladder or kidney stones. Hard mineral deposits may irritate the urinary tract or cause blockage. Now, this may cause pain or urinary frequency. Another cause may be tumors or cancer. that is cancerous or non-cancerous growths in the bladder. Now, these growths may also be present in the prostate or the surrounding pelvic area, and therefore, this may obstruct urine flow or irritate the bladder in the process. Urinary symptoms may also be caused by pelvic organ prolapse. Now, in women, weakened pelvic floor muscles can cause organs such as the uterus or the bladder to suck into the vagina. Now, this may kink the urethra and obstruct urine. Now, another important cause of urinary symptoms is constipation. Rectum that is full of compacted stool may put pressure on the bladder. This may lead to frequent urination or a feeling of incomplete emptying. Urinary symptoms can also be caused by systemic diseases and other factors. An example of systemic diseases that I have already mentioned is diabetes. Now, for diabetes, we have diabetes type 1 and diabetes type 2. Now, diabetes can cause the kidneys to overwork themselves in the process of filtering excess glucose. Now, this can lead to increased urine production, that is polyuria or frequent urination. Now, these ones are often the early symptoms of the disease. Another cause of urinary symptoms other than BPH is medications. Certain medications such as antidiuretics, that is water pills, antihistamines, antidepressants, and some high blood pressure medications can affect bladder muscle function and therefore may in the process increase the urine output. Now, another cause of urinary symptoms other than BPH is lifestyle factors. Excessive intake of caffeine, alcohol, or carbonated beverages can act as bladder irritants or diuretics. This may in turn increase urination frequency and urgency. Urinary symptoms can also be caused by weak bladder muscles. Weak bladder muscles can also be caused by aging, childbirth, chronic overdistension, which can in turn weaken bladder muscles leading to incomplete emptying or incontinence. Now, in case your primary care doctor or a urologist has told you that your urinary symptoms are caused by BPH, that is benign prostatic hyperplasia, you can do what we call conservative management. That is, after waiting and notice that the symptoms persist, we can use the following lifestyle and behavioral changes in order to control the urinary symptoms. Fluid management is one of the changes that we can do. You need to limit fluid intake before bedtime. You need to cut on caffeine, alcohol, sugary drinks, and artificial sweeteners. Now, the bladder voiding habits involves practicing timed voiding. That is urinating after every 2 to 3 hours, and double voiding, that is urinating, waiting for a few minutes, then try again. You also need to check on diet and exercise. Maintain a healthy diet, avoid processed foods. In addition, get regular physical activities. You can as well do bowel health. So in this case, you avoid constipation because constipation can cause rectum to exert pressure on the bladder. You can also check on the pelvic floor, that is doing pelvic floor exercises. That is Kegels for urgency and also storage for relaxation. We can as well use medication approach. So one of the medications that we use is alpha blockers. I have actually discussed about alpha blockers in a previous video. So that video I have discussed about alpha blockers. Alpha blockers is a group of medication that relax the bladder neck and also the muscles in the prostate, improving the flow of urine very quickly. Alpha blockers do not shrink the prostate. Examples of alpha blockers include tamsulosin or Flomax, alfuzosin or Uroxetral, terazosin, and doxazosine. Side effects of alpha blockers include dizziness or lightheadedness, fatigues or weaknesses, headaches and nasal congestion, ejaculation issues, particularly retrograde ejaculation. Retrograde ejaculation is a process through which semen enters the bladder instead of exiting through the penis. Another effect is intraoperative floppy iris syndrome, which normally occurs during cataract surgery. Now, this may require ophthalmologists to take a lot of precautions. Another group of medications that we can use is 5-alpha reductase inhibitors. So this is a group of medication that normally prevents the conversion of testosterone into DHT, that is dihydrotestosterone. Dihydrotestosterone is what causes prostate growth. 5-alpha reductase inhibitors can lead to prostate shrinking over several months. These 5-alpha reductase inhibitors work best with men who have got very large prostate glands. Examples of these drugs is finasteride, also known as Proscar, or dutasteride, also known as Avodat. Side effects include erectile dysfunction or ED, reduced libido, also known as sex drive, reduced volume of ejaculate, gynecomastia, that is breast tenderness or enlargement, These drugs may also be associated with depression and anxiety in some cases. That means that this drug should be taken with high precaution, especially in pregnant women, because it might have a potential risk to a male fetus. Another group of medications that we can use to treat urinary symptoms is phosphodiesterase 5 enzyme inhibitors, that is PDE5. Example of such drugs is tadalafil. Here is a video that explains the use of tadalafil Cialis to treat erectile dysfunction. Side effects of tadalafil include headaches, flushing, back pain, and dyspepsia. Tadalafil is contraindicated in patients taking nitrates. The next group of drugs that we are going to use to treat urinary symptoms is known as anticholinergics or beta-3 agonists. Anticholinergics can be added to an alpha blocker to help those with overactive bladder symptoms such as urinary urgency and frequency. Side effects include dry mouth, blood visions, and constipation. Hypertension may also be experienced for those who are using beta-3 agonists. Now, another treatment options involve combination therapy. In this case, an alpha blocker may be added to 5-alpha reductase inhibitor to treat severe symptoms and a large progress to prevent disease progression. This approach has more side effects than either drug used alone. We can as well use surgical option for treating BPH. One of the reasons a patient may opt for surgery is where we have acute or recurrent urinary retention. This is the inability to urinate at all. Another reason one may opt for surgery is where we have recurrent urinary tract infections. Recurrent urinary tract infections may be caused by inability to empty the bladder completely. Another situation is where we have bladder stones or diverticular, that is the presence of pouches on the bladder wall. Another situation where we may opt for surgery is where we have kidney damage or kidney insufficiency. Now, kidney damage or kidney insufficiency may result from urinary tract obstruction. We may also opt for surgery if we have recurrent blood in the urine. Recurrent appearance of blood in urine is known as hematuria. Hematuria may be resistant to other treatments. You can also opt for surgery if you have an overflow incontinence. Overflow incontinence refers to leaking of urine because the bladder is too full. Also, inadequate relief from other treatments may make someone to opt for surgery. For many men, medication and lifestyle changes are the first line of treatment. Surgery may be considered if these methods do not provide sufficient relief from bothersome symptoms, become ineffective over time, cause unacceptable side effects. One may also opt for surgery if they desire long-term efficacy. Surgical treatments, particularly procedures such as transurethral resection of the prostate or laser enucleation, always provide more significant and durable improvements. That is, if you compare it with long-term medication use. Surgical procedures may also be considered under specific patient preferences and circumstances. Choice of surgery may also be considered by personal factors and the specific nature of BPH. For example, the prostate size. Some procedures such as open or simple robotic prostatectomy or HOLEP are specifically designed for very large prostates that may not respond well with other treatments. Now, another example is patient preference, where a man may decide not to take daily medications or desires the rapid onset of symptom relief, which that surgery can offer. Another example is where we have concurrent health conditions. Certain minimally invasive surgical techniques, such as some laser therapies, may be safer for men who must remain on blood-thinning medications. Another specific patient circumstance and preferences involve cost effectiveness. While the initial cost is higher, long-term studies suggest that surgery can be more cost-effective, that is compared to continuous long-term therapy over a 10-year period. Untimely, the decision to pursue surgery is arrived at as the one that is shared between the patient and the healthcare provider. Now, the patient and the healthcare provider carefully weigh the benefits and the risks, besides considering the patient's overall health and also lifetime goals. Now, let us discuss the types of surgeries that are normally done to treat urinary symptoms. So the first one is minimally invasive procedures. Now, this type of treatments are normally done in outpatient settings with minimum recovery time. Now, this type of procedure aims at preserving sexual function, particularly ejaculation. Examples of this type of procedures include prostatic urethral lift, that is urolift. In this type of procedure, Tiny implants are normally used to hold the enlarged prostate lobes back. It involves lifting them out of the urethra to improve urine flow. This procedure ensures that no type of tissue is removed. Now, the next minimally invasive procedure involves water vapor thermotherapy. This procedure uses stored thermal energy in the water vapor to ablate excess prostate tissue. The destroyed tissue is then reabsorbed back by the body. Now, in the process, this shrinks the prostate, improving urinary flow over a few weeks. Another minimally invasive procedure involves laser therapies. For example, green light laser therapy. Lasers such as green light are used to vaporize. HOLEP aids in enucleating obstructing prostate tissue. These procedures often lead to less bleeding and less stays in the hospitals as compared to traditional surgeries. Now, the next on the list is aquablation. Now, this is a robotic assisted procedure. This procedure uses heat-free high-velocity water jet to precisely remove prostate tissue, that is, based on a detailed surgical map. Another minimally invasive procedure is called prostatic artery embolization. This procedure, also known as PAE, is normally done by a radiologist. In this case, tiny particles are normally injected into the arteries that supply the prostate. In the process, this procedure cuts off the blood supply, and in the process, it shrinks the prostate. Now, the next type of procedures that we are going to discuss is traditional surgical procedures. These procedures are typically designed for patients with very large prostates. They are also applicable to those ones who have not responded to other treatments and are also more effective and durable. An example of traditional surgical procedures involves transurethral resection of the prostate. This procedure is normally considered to be a historical gold standard. This procedure involves inserting an instrument into the urethra to trim away excess prostate tissue using electrical loop. Another traditional surgical procedure is simple prostatectomy. Now, for cases of massive prostate enlargement, the inner portion of the prostate gland is normally removed through an open incision or laparoscopic or robotic approach. You need to know that this procedure differs from radical prostatectomy. Radical prostatectomy normally removes the entire gland to treat prostate cancer. The ideal procedure depends on factors such as the size and the shape of the prostate. Other factors include severity of the symptoms and the patient's preferences, potential side effects including side effects on sexual function. Now, surgical procedures that are done for large prostate includes HOLEP. HOLEP means holmium laser enucleation of the prostate. Now, this is a widely recommended and minimally invasive procedure. In this case, a laser is used to cut off, that is to enucleate or to peel off the excess tissue from the capsule, which is then removed from the bladder. In this procedure, we use a Morse letter. Now, the main advantage of this procedure is that it can be used on any size of the prostate. The procedure also can lead to less blood loss and lesser hospital stays as compared to other procedures. Now, this procedure also provides a tissue for further analysis. Now, the consideration for this procedure is that it requires a specialized expert. Another surgical procedure for large prostates includes simple prostatectomy. Simple prostatectomy can be open or robotic assisted. This involves surgically removing the inner core of the prostate gland. The open method is a traditional approach for very large prostates. It normally involves incision on the lower part of the abdomen. The robotic assisted is less invasive as discussed in the above. It involves smaller incisions, less blood loss, and a shorter stay in the hospitals. The main advantage is that it is highly effective for enlarged prostates. It can address other issues simultaneously, such as larger bladder stones. Now, the consideration that you have to make is that you need to know that it is more invasive than transurethral methods. It involves a longer recovery time with a higher risk of bleeding. Another surgical procedure that is done on large prostate is photoselective vaporization of the prostates. While sometimes it is less effective for very large prostates as compared to enucleation methods, high-powered lasers can vaporize tissues and are a good option for men taking blood thinners. That is due to minimum blood loss. The choice of procedure depends on several factors. That is the specific size of the prostate, the overall health of the patient, and also a patient's preference regarding the potential side effects. It is important to discuss these options and potential outcomes with a qualified urologist. That is to determine the best approach.